Hey, I'm Dr. Michael Lang. We want to age as gracefully as possible, don't we? So is there enough evidence out there that proves that certain specific nutrients, ingredients, or supplements can enhance, our skin, our joints, our hair, our nails? And there's a lot of great science that's come out recently with marine collagen tripeptides, riceramides, hyaluronic acid, and there's a new supplement called Dermaval. Well, we've taken all four of those and we've combined it in a supplement called Rejuvenate. 3 delicious flavors, chocolate, cherry vanilla, pink lemonade, and then we have it unflavored for those of you that want to just put it in your coffee in the morning. It's worth a try. I endorse it, obviously, 100%. If you don't like it, we'll give you money back. It's as simple as that. So check it out at fortify.com.
Doctor with Michael Lang begins in 10 seconds.
When it comes to your health, are you seeing the check engine light come on more than normal? It's time to get under the hood. It's time for Ask the Doctor with Dr. Michael Lang. Sponsored by Lang Eye Institute and Fortify Vitamins. Dr. Lang is a board-certified optometric physician and certified nutrition specialist, helping people see and feel better through proper nutrition for 25 years. The doctor is in. Call now with your questions at 813-282-8283. That's 813-282-8283. Here's your host, Dr. Michael Lang.
Okay, good morning and welcome to Ask the Doctor. I'm your host as usual, Dr. Michael Lang of the Lang Eye Institute and Fortify Vitamins, here each and every Saturday morning live to answer any and all questions you may have regarding your vision, eye care, or a nutritionally related topic. So don't be shy, pick up the phones and give us a call. When I say give us a call, it's not only myself, Dr. Michael Lang, but my co-host, Dr. Susan Somerton, who is also hailing from the Lang Eye Institute and Fortify Vitamins. And she's also an optometric physician, certified nutritional specialist, and a diplomat and a fellow in many nutritional arenas. So the phone number is 813-282-8283. We have light. 813-282-8283. Remember, this show is dedicated to you, the listener or the viewer. So no matter how simple or complicated, we will try to answer to the best of our ability. I've been hosting Ask the Doctor since April of 1993. Officially, we are the longest running medical doctor-hosted live radio talk show in the country right now. Since 1993. This is nonstop, all right? Even past Dr. Dean Adele. So once again, I started Ask the Doctor April of 1993 on a little radio station called WMOP MOP in Ocala, Florida. Country Jim Kirk gave me an opportunity, and it's evolved from there. Now we're a syndicated show. We're on the Ask the Doctor network, coast to coast, and live video streaming all over the world. Anyway, I want to take this opportunity to tell everybody a happy Kentucky Derby Day. And all of my Ocalian horse people, I know this is a big day for you, probably the biggest day. So happy Kentucky Derby Day. And also, I want to mention this is a Health Vision Month. And Dr. Somerton is going to chat up a little bit about that in a minute. But let's take this opportunity to welcome Dr. Susan Somerton to Ask the Doctor. Good morning, Susan.
Good morning, Dr. Lang. And that is quite an accomplishment to have that long-running radio show. It's an amazing amount of effort and time on your part spreading to help people with their eye care and nutritional needs. And just congratulations for doing that. I know how much effort you have put in it over the years, and it's just fantastic that others can help from that.
It is. And I tell you, April of 1993 really doesn't seem like it was that long ago. You know, that old saying, time flies when you're having fun. It surely has. And, you know, I'm 60 now, maybe a tad over 60, but, you know, I really feel like I'm probably 30 still, and I can still hang with Logan, who's 28. Actually, I can stomp him into the ground if he's listening. We got a lot to talk about today. The topic of today is going to be macular degeneration. All right. We have a lot of people listening out there that have been listening for 30 years that are vision impaired. Some of them are blind and they can't really watch television, so they listen to Ask the Doctor. And macular degeneration is a disease of the eye that can affect us as we mature. It's called age-related macular degeneration because we're more prone to develop it as we get older. And it is one of the leading causes of vision impairment in the world today, if not the United States. And I said vision impairment. I didn't say blindness. Now, you can become legally blind from macular degeneration, but that's not the same thing as being totally blind. Remember, macular degeneration steals your central vision, all right? It doesn't affect your peripheral vision, but other diseases can indeed affect your peripheral vision, things like glaucoma, retinitis pigmentosa, diabetic retinopathy, many other diseases, retinal detachments, and things of this nature. So we want to stay as healthy as possible, and this is really the hallmark of today's show is talking about how macular degeneration, in my opinion, is a nutritionally responsive disease. I did not say it's a treatable disease with diet, nutrition, or supplements, but it's a nutritionally responsive disease. Dr. Summerton and I have been doing this a long time. I've been doing it longer than she has. And we have seen what works and what does not work, okay? And we are also one of a select group of optometric physicians that are certified nutritional specialists in this country. So we go above and beyond with hours for nutritional education. So not only do we get our eye hours, we get our nutritional hours, which we probably get more of than our eye hours. We go to a lot of conferences. Fortify Vitamin sponsors a lot of conferences. So we're sitting through a lot of nutritional courses throughout the year. And once again, I like to think that macular degeneration is a nutritionally responsive disease. And what that means is I've seen over the years patients that adjust their diet and adjust their supplements so they get on the right diet, which incorporates avoiding the wrong foods and eating the right foods. They get on the right supplements. So that's avoiding the wrong supplements, taking the right supplements, and doing some other things like wearing sunglasses and getting down to their ideal body weight. All of this is important in our macular degeneration patients. And Dr. Summerton, we try to take a whole body approach with our patients, and we take that also with our macular degeneration patients, counseling them on things like diet, supplements, weight management. And it goes a long way, doesn't it?
It does. And you mentioned nutrition is a passion of ours. And this week, that's what I've been working on. I'm a PowerPoint presentation on nutrition for the doctors at the Florida Optometric Association in July. So we also want to teach other doctors about the importance of nutrition. But it really is a way where we can really intervene and help people. And I just want to kind of go over for listeners what macular degeneration really is. And like you mentioned, it is the leading cause of vision loss in Americans age 60 and older. So that is a very serious disease that we have to consider what we can do, because it gradually destroys that central vision. There's dry, and that occurs when the light sensitive cells in the macula, which is the center of the eye, they slowly degenerate, they break down. And then people heard of wet, and that's where if you've had a friend or a relative get injections in their eye, that's usually because they have wet macular degeneration. And that's because these abnormal blood vessels behind the retina have started to grow and they can bleed. And then you can get a sudden loss of your central vision. So both of them are quite serious. Fortunately, dry is way more common, about 80% over the wet. And when we see dry, that's when we want to intervene and give the patient the right nutrients in the right combination, not too much, not too little, because that's what we see as well. It can be damaging for things like zinc if you overdo it, and it's getting the right amount, talking to your doctor to figure out what is the best combination of nutrients so we can prevent the degeneration from getting worse.
Right. And I want all of you to go to a website, fortify.com. That's FORTIFEYE, fortify.com. And go to the section on macular degeneration. Go to eye care, go to macular degeneration, or just go to Fortify Macular Defense and Fortify Zinc Free Macular Defense and read the description on that and go to the science section and educate yourself on what we've put together there. Remember, this is a vitamin that's evolved over the last 30 years. We've changed Fortify Macular Defense and Zinc Free Macular Defense 17 times in the last 20 years. And we'll expand on that in just a minute. But let's go to the phones. I think Charles in Gainesville is waiting patiently. Charles, good morning. Welcome to the program.
Good morning. Thank you for taking my call. My question for you is, I have been on a lot of antibiotics in the last 6 months, and I'm starting to have a lot of inflammation in my muscles in my back and chest and arm on my left side. I'm taking your Fit Pro and your multivitamin and the Focus Brain. I'm going to a massage therapist and a chiropractor, and I'm just really struggling getting ahead of it. I don't know if the antibiotics have something to do with it, but I haven't had this problem before.
Well, Charles, let me ask you this. Why have you been on, long-term chronic antibiotic use?
Well, I had an infected tooth, and I was trying to go to the UF dental clinic for it, and it fell through, and I ended up being on 4 doses of antibiotics. And then a couple of months later, I got an infected finger, and the oral antibiotics didn't work, and I had to go to the hospital, and I was on IV antibiotics for 6 days, and then on oral antibiotics for 7 more days after that for the finger. And it was a staph infection.
All right. So let me ask you this. Have you been taking probiotics? Have you been eating fermented foods or not?
Yeah.
Yeah.
Yes.
Good. That's interesting. Do you think you actually have muscle breakdown, or are you just sore?
Some of it kind of feels like breakdown. With the soreness of it, it's like making my shoulder weak. I'm not sure.
Right.
Like I said,
And how old
I've
are
been
you?
to my doctor, and I'm on an anti-inflammatory, and I'm also on muscle relaxers. I'm taking extra magnesium, to try and relax my muscles. And
Right. So, there's a whole host of things that could be going on. I think it's time for, your primary care physician to run a battery of tests, and also looking for some autoimmune and inflammatory conditions. It's hard to talk about this. Is it related to long-term antibiotic use? That's a good question. Long-term antibiotic use can cause potential problems. Usually it can break down, the microbiome in your gut. And if the microbiome in your gut goes to hell in a handbasket, then everything else follows. So
Right.
I'm going to let Dr. Summerton maybe chime in if she's got any ideas as well.
Okay.
Right. I agree. It can be a numerous of things because it's not just the antibiotics on, it's other things you're on. But check your probiotic. I'm not sure what probiotic you're on, but make sure it has a variety of strains because there's so many different probiotics out there. When you're taking the antibiotic, you're killing both the bad bacteria that we want killed, but you're also killing the good bacteria. And so
Right.
it all depends on the time that you're taking it. You don't want to take your probiotic the same time as your antibiotic either.
Right.
Yeah. And
I
would definitely get a battery of blood tests through your primary care physician to find out what's going on, and then and certainly let us know. Keep us posted on this.
Okay.
Are you on a statin? Are you on
What
like
is
a
that?
statin one anything for cholesterol?
No.
Okay.
All right. Yeah, it's kind of interesting. Keep us posted on that. But get into let your primary care physician know that you're having these symptoms for sure, and then they can look at they can do some blood tests that will point them in the right direction to determine what indeed is going on.
Okay.
All right, my friend. Good luck.
Thank you. Thank you very much.
All right, you're listening to Ask the Doctors. The phone line is now open. If you got a question, give us a call at 813-282-8283. That's 813-282-8283. And anytime we put people on oral antibiotics for any long period of time, even short periods of time, even if I put somebody on a oral antibiotic just for a sty in their eye for a relatively short period of time, I tell them to take probiotics and to eat some yogurt or some kefir or some sauerkraut, or to do both of those, because even short-term antibiotics can disrupt the microbiome in your gut. And like I said, then you can have some big problems. So we're talking a little bit about macular degeneration. We're getting ready to go to the next call in just 1 second. But I just want to mention the Fortify Macular Defense and the zinc-free macular defense that I created originally, over 20 years ago. Like I said, we've evolved this 17 times over the last 20 years based on ongoing research that we're involved in, based on national and international research as well. And this is a supplement that has a combination of the nutrients that we like to think uh, bring the nutrients and the nutritional value that the retina is thirsting for. So things like lutein, zeaxanthin, mesozeaxanthin, resveratrol, black currant, astaxanthin, saffron, grapeseed extract, pine bark extract, bilberry, taurine, acetyl L-carnitine, alpha lipoic acid, CoQ10, and of course B complex with the methylated forms, C, D, the 8 forms of E. No beta carotene. I repeat, you don't want to be taking anything with beta carotene. So those of you with macular degeneration, I would highly recommend not taking a multivitamin that has beta carotene in it. Beta carotene can block the absorption of lutein, zeaxanthin, and astaxanthin, the carotenoids in the xanthophyll family. And it gets complicated, but believe me, it happens. And the same token, don't eat a lot of carrots, sweet potatoes, or pumpkin, because once again, it can block the beneficial nutrients in spinach and kale and orange bell peppers and goji berries and wild Alaskan salmon. So we'll talk about the perfect meal for macular degeneration in a few minutes. But if you do have macular degeneration, you don't have to take Fortify Macular Defense, but at least use that website and use that ingredient profile as a template. And then you can find something that's very similar to that. But go to fortify.com and go to Next Gen Macular Defense. And we'll talk about when I think you should have zinc and when you shouldn't have zinc as well in just a few minutes. But let's go to the next caller. I think it's Steve in Clearwater. Steve, good morning. Welcome to the program.
Yeah, you know this thing going on in Florida now about making fluoride illegal to put in the water supply?
Yeah.
Okay, I found an interesting article which would apply to the eye health. It's called Metabolic Disturbances of the Retina Due to Sodium Fluoride. And what's interesting is that there's some points about what it seems to do is if you give a person a small amount of fluoride, it will allow the neurons in the photoreceptors to depolarize at a lower threshold. In other words, if you gave me a dose of fluoride and it was dark in the room, I would see slightly better than if I didn't have the fluoride, because a fluoride ion acts very similar to a light photon in terms of what it does to the retina. Good or bad? Probably neutral. The other thing is that there seems to be some evidence that fluoride may help inhibit melanomas in the eye. Not everywhere else, but in the eye. And there's a long story about that. And another thing is, I think that what I noticed about this issue was that the way we discuss scientific issues in the public forum is terrible. It's all anecdotal. They bring people before committees. They speak in generalities, and they don't get down to the methodology of the studies. They don't talk about exactly how they came to these conclusions. They just tell you what the conclusions are. And I think there should be a better way. We should examine public health issues the same way that science studies their own issues, in a more logical way, instead of what the political, air, which way the political air is blowing. And anyway, with the fluoride, I think it's very interesting. And another thing is that they found out, of course, I've told you this before, that the trace mineral molybdenum in high areas where there's molybdenum in the soil cavities are much less, just like fluoride, but it doesn't seem to have the negative effects of fluoride. And also strontium and boron seem to be very important. So that's my little tidbit of the day.
Well, I know strontium does help calcium absorb, so strontium is important for that. I think the whole idea behind getting rid of the fluoride in the water system, I think there's some evidence that, accumulation of fluoride might have some negative impacts on our overall health. And I'm sure there's things that maybe it does impact positively. So, yeah, I think the least chemicals in our body, the best, obviously.
Well,
But
they've done studies on the osteoporosis. They thought, well, if it toughens your teeth, it should toughen your bones. And I don't know. Those have been mixed results. I don't know where they've come down on that. But I agree that why put it in there when you can get it in just what I would be in favor of is reduce the fluoride in the water supply, remove it from the soil, and then increase. Right now, I think the government regulations are for 0.15 weight per volume for the toothpaste.
mhm.
And I'm not sure if they could increase that. You can buy a toothpaste, it's under prescription, which has far more fluoride than the average toothpaste does. So if you want it, I wouldn't recommend it for children, but I think for adults it would be very good.
Right.
And
All right.
yeah,
Well,
I
that's
don't know.
the food for thought. I'm going to talk to Kennedy about that, Steve, and we'll put your thoughts in and we'll implement it. How's that sound?
Well, he's doing a very good job.
Yes, he is.
He makes some mistakes because he makes some mistakes when he's speaking of things. And unfortunately, people jump on that, on the other side.
Mhm.
But his overall effect is going to be very, very good.
I agree.
Very good.
All right, Steve.
Okay.
Thanks for the call.
God bless.
All right. As usual, Steve has some comments that sometimes even go over my head. Ah. All right, we're getting ready to take the next call. Let's see, it's 813-282-8283. Give us a call. Dr. Susan Somerton and myself, Dr. Michael Lang, here to answer your questions. Remember, this is for educational purposes only. It never replaces a comprehensive eye evaluation or medical evaluation. 813-282-8283. We're going up north now. We're going to go to Rich in Jackson, New Jersey. Rich, good morning. Thanks for holding.
Good morning. Good morning. Appreciate it, Doc. How are you, sir?
Fantastic. And yourself?
I am fantastic as well. You spoke to my wife last week. Her name is Jackie from my area. We're moving down to Florida, and she's looking forward to seeing you about the eye laser to help her with dry eye.
Right.
And I appreciate you on that. She's very excited about that. I have a question that might not be applicable, but I just wanted to throw it at you since your knowledge, She's on SAMe, and they just put her on Buspirone. And she starts Googling, which gets her into trouble. And Google's saying that they interact negatively together. I know her doctor knows about it. He wouldn't put her on it if he didn't think it was appropriate. And she's been on it for a very long time. Does that matter in your mind, Sammy, with Buspirone as an example for what the serotonin levels can get impacted on?
Yeah, I'm definitely not an expert in that arena, so I don't want to chime in on something I don't know a lot about. But if she did Google
And
it,
that's okay.
and if she found out there is some conflicting evidence with those two drugs and they don't interact well together, believe it or not, doctors are not gods. And so some think they are, but doctors not gods, and sometimes they can make a mistake. So it's not a bad idea if there is something conflicting on that to just bring it to her doctor's attention and ask them,
Sure.
And if the doctor says, well, I can't answer your questions, then it's time to get another doctor. But I'm sure your doctor's a good
I
doctor.
agree.
I would bring it to his or her attention.
He's knowledgeable like you in clinical nutrition as well. So we respect him very highly. But I just wanted to run it past you. And like you said, I don't believe in everything doctors do also, because I cured myself of prostate cancer with my doctor.
Good.
Which shocked him.
And
I also...
Rich,
I did other things like that. I just wanted to share, but go ahead, sir.
Rich, you can send me an email at iDude92. That's EYEDUDE. So I like your eyeball and dude like, hey, dude. So iDude92 at iCloud.com. And just ask that question, and I will either direct it to a leading authority, or I'll do the research, and I'll give you a much better answer on it.
Super. Truly appreciate it, sir, and look forward to seeing you when we get down there in June.
All right, Rich. I look forward to seeing you and your wife. Take care.
Have a great day. Thank you. Bye.
Bye-bye. All right. I think this next question might be in Dr. Summerton's wheelhouse. We're going to see. It's Joanne in Sarasota.
Hi there. Good morning.
Good morning.
I have found your program so informative. You've got me hooked.
Oh, thank you.
I have a, excuse me. I have a couple of questions. One is, I suffer from thrush because I have an autoimmune disease which causes dryness, etc. And I want to know what you know about thrush and the treatment of, not only did I get it in my mouth and nose, but in my esophagus and elsewhere. What do you recommend, first of all, to avoid eating, and then to eat, and any treatment thereof?
All right. So a lot of people that will get dry mouth and dry elsewhere, you'll have Sjogren's syndrome, and it's related to an autoimmune, obviously. And we see this on a daily basis. And I would like to say, if you would follow a diet, an anti-inflammatory diet, similar to the one I developed called Lang's Survival Diet, and you can Google that, Lang's Survival Diet. And we've taken out all of the anti-nutrients in the diet, things like lectins and phytic acid and gluten and FODMAPs and protease inhibitors and phytoestrogens. And the list goes on and on. And so there's only, two pieces of food you can eat. You can eat a piece of celery and one pea. I'm just teasing. Okay. So this anti-inflammatory diet, just by doing that, it will help. Okay. But there's certain supplements that I would recommend. And like I said, my average patient's 80 years old and has these exact symptoms. And so we want to address the problem symptomatically first by just using a good lubricant in your eyes. All right. And you can also get lubricants.
I do that very religiously.
So I like Oasis Tears and I like Optase. Those two the best because they have hyaluronic acid in them that acts as a natural anti-inflammatory. But taking a good triglyceride or reesterified triglyceride form omega-3 fish oil, and here's the caveat. So our Fortify Super Omega, you bite into it and chew it instead of swallowing it. And what this will do, the oils will go into your mouth and coat your throat while it goes down, helping the dry throat, the dry esophagus, the dry mouth. Okay. So Fortify Super Omega, usually 2 a day. Bite into it, don't swallow it. Then you can discard the collagen, the gelatin if you would like. And then I also like black currant seed oil. You don't want to bite into that because it would be nasty tasting, but black currant seed oil actually stimulates something called series 1 prostaglandins. And so our typical American diet, even the Lang Survival Diet, will help stimulate series 2 and series 3 prostaglandins. These are inflammatory cascades, and foods that you're eating can do that, but it's very hard to stimulate the series 1 prostaglandin inflammatory cascade because we're not eating borage oil or black currant seed oil or what's the other one? Evening primrose oil or spirulina. And so these type of nutrients stimulate series 1 prostaglandins that will help with the lubricating properties in your eye and your throat. So we have a product that takes all of this in a combination. It's called Fortify Advanced Dry Eye Therapy. And it's a box that comes with 3 different supplements in it. And I would highly recommend trying that, or at least trying something very similar to that. And then obviously drinking a lot of fluids. And do you have a rheumatologist that you see?
Yes, I do. I wanted to ask you, I am taking something right now. It's probably not as good as yours. It's called Hydrate Tears Again. It has 1,000 of flaxseed oil, evening primrose 500, and bilberry 50 mg. What is the name of, you went so quickly I couldn't get it. What is you say flaxseed advanced eye therapy? Is that what you said?
It's called Fortify Advanced Dry Eye Therapy. And the problem I have with the one that you're using is it doesn't have any reesterified triglyceride omega-3. It has flaxseed, that's ALA, alpha linoleic acid. That's a plant-based omega-3 that if you're over 35, 40 years of age, you're not going to be able to convert to the omega-3s. So it's probably pretty useless and it goes rancid fairly quickly. So I am an expert in this arena. Dr. Summerton's an expert in this arena. I want to let her chime in with her thoughts because she's a female and she deals with a lot of people that are in the same exact situation.
Well, where can I, are either of you close to Sarasota?
Well, we're at the Lang Eye Institute in the Villages. We have a lot of patients that come from Sarasota. So it's about an hour and 20 minutes on the interstate, further north,
Right.
the Lang Eye Institute. And then there's some other things that we can do. We've been talking a lot about IPL, luminous opti-light. So what we would do is evaluate your meibomian glands. And oftentimes with your condition, these meibomian glands will be clogged. And the best way to unclog them is with intense pulse light therapy. We have the only one that is FDA approved for dry eye treatment in the Villages. So that's something to think about. It wouldn't be a bad idea to see Dr. Summerton or myself for, an evaluation to determine, what path to go down.
Mm-hmm. Well, that is all helpful. I can go online and order some of these products, correct?
Right. You just go to fortify.com and it'll ship out our distribution headquarters right here in Clearwater, and you'll get them pretty quickly in Sarasota.
Well, now back to the thrush. What do you recommend to help inhibit that? Because they had me on fluconazole, and I won't take that for, as a maintenance drug all the time. It's too powerful.
Dr. Summerton, I'm going to let you chime in a little bit. I'm going to have some water.
Good morning. I think
Good morning.
With Candida, I just know a good kind of old-fashioned remedy is grapefruit seed extract. So it's not grapefruit juice; it's grapefruit seed extract. And
right. You're saying grapefruit, right?
Yes, grapefruit seed extract.
Right.
And when you do that, you can usually it comes in liquid in drops, so you can dilute some of that with water and rinse your mouth out with it every day. You can also just ingest it orally. You do have to be careful with your other medications because it does fall in the grapefruit category that you have to be careful with some medications I'm taking it with. But that is a really just nice little remedy for those people getting thrush or any candida infections there. And then having a autoimmune disease, if you're taking B vitamins, you need to look at the label and turn it over, look at all those little words on the back, and make sure it's what methylated. So like if you look at the B9, it needs to say methylfolate. If you look at the B12, it has to say methylcobalamin, because a lot of people with autoimmune diseases and the population in general now have what we call a defect in methylating the B vitamins, and that can actually make it worse. So it's kind of a genetic mutation that a lot of people have. So you just
what
have
is
to
the number I call to the office to make an appointment?
Yeah, I'll get a pen. I'll give you the number. All right. So for the Lang Eye Institute, it is 352-753-4014. One more time, 352-753-4014.
Do you ever do any lectures close by? Do you come to St. Pete at all?
We've done, Susan currently, I've lectured all over, but Susan lectures all over, mainly to doctors all over the country. We used to do a lot of lectures in the Villages back when I had a little bit of a life, but there's just not enough time in the day to do everything I want to do. So that's why we do this talk show, because we can hit the masses with this talk show. And every now and then I'll go to the Clearwater Fortify Nutrition Center and hang out from 1 to 3 and meet and greet and talk nutrition to people at that venue as well.
You should come to the Meadows down here in Sarasota during the season.
The Meadows.
You'd get a very large group. Yeah. I think it's, it's quite large here.
Right.
Yeah. Well, thank you, both of you, very much.
All right. Thanks for the call. You have a great day.
Bye-bye.
Bye-bye. All right. You're listening to Ask the Doctors. Give us a call, 813 813-282-8283. We are opening up the phone lines now. So 813-282-8283. Like I said, we're broadcasting through the Ask the Doctor network all over the country, coast to coast. And it's actually good morning, good evening, and good afternoon, depending on what part of the globe you're actually watching us on social media and live video streaming, or on a multitude of podcast channels as well. And Dr. Summerton and I are both available to see new patients. So you can call that number at the Lang Eye Institute in the Villages. It is 352-753-4014. One more time, Lang Eye Institute. We're open Monday through Friday. It's 352-753-4014. And I like to think we're a dry eye center of excellence. We have just about every type of high technology available to help dry eye. We've got non-invasive technology, non-surgical pieces of technology. We certainly have all the nutritional supplements. We've got amniotic stem cell enhanced membranes. We have punctal occlusion. We have the OptiLift, and we have the OptiLight. So we can do a lot for people that have dry eye. And that's an arena that both Dr. Summerton and I are real excited about, this new technology, and we're really embracing it. And it's really nice to be able to help patients that come to see us that have been told they have dry eye and just to use artificial tears. And really, Dr. Summerton, there's a lot more things that we can do, very innovative, than just artificial tears. Isn't that a fact?
It is. And we have taken it to the next level, because not only is it frustrating to the patient, we can help them and make them feel better, but we want to get it to the root cause. And now we have this technology of getting into those meibomian glands. Those are the ones responsible for secreting the oil into your tear film to prevent your tears from evaporating. They're along the inner surface of your eyelids. And this has a way of targeting with intense pulse light, and then also tightening the lids with electrical frequency, radio frequency, to make sure every time you blink, the structure is there. You're getting a complete blink, like the proper windshield wiper effect. And then we're really targeting the root cause, which is essentially what we want to do, is make sure we're taking care of the entire problem.
So if you've got dry eye and you want a second opinion, certainly come see us at the Lang Eye Institute. Also, I see a lot of people chime in on social media asking questions about, what vitamins do we recommend for macular degeneration? And of course, I'm a little bit biased. I have developed the Fortify Macular Defense and Zinc-Free Macular Defense. It's called Next Gen Macular Defense and Zinc-Free Macular Defense. And this is actually your multivitamin and eye vitamin. Remember I told you beta-carotene is not a good thing to be in a supplement for macular degeneration. So we have no beta-carotene in it, but we have a list of all those other ingredients I went over just a minute ago in the Fortify Macular Defense. So my recommendation, can't talk this morning. That's due to lack of sleep at 2 hours. So is go to the fortify.com website. Remember, it's kind of a play on words. Fortify is Fortifeye, fortify.com. Let me give you the phone number for Fortify Vitamins. I'm going to give it to you twice. We are answering the phones until 3 today. It's 866-503-9746. It's 866-503-9746. But once again, I'm going to go over briefly what I recommend people, and this is based on years of experience seeing patients with macular degeneration, also based in some DNA studies that I was involved in post-AREDS 2, DNA macular degeneration studies, and some blood studies. And I've developed 4 questions that we ask patients to determine if they would need the one with zinc or not the zinc. Number 1, if you're a vegan, you need Fortify Macular Defense that has the zinc. If you drink a lot of alcohol, you need a little extra zinc. So you need the one not the zinc-free. If you have ulcerative colitis or Crohn's disease, you need the one with zinc. All right. So a vegan, ulcerative colitis, Crohn's disease, alcohol, or if you're on a diuretic, then you need the one with zinc. Otherwise, take the zinc-free macular defense, because most of you are getting enough zinc in your daily diet and in other supplements you're taking. Also, they asked about food for macular degeneration. The perfect meal for macular degeneration, I'll write this down, and really this is the perfect meal for longevity, not just macular degeneration, is to take some wild Alaskan salmon and saute it in coconut oil. Wild Alaskan salmon is high in the best form of omega-3, which is good for macular degeneration, has astaxanthin in it. That's good for macular degeneration. Coconut oil has been shown to also be beneficial. And then you take some organic kale or baby leaf kale. I didn't say spinach, I said kale. Orange bell peppers. The kale is high in lutein. Orange bell peppers are high in zeaxanthin. You throw that in and saute it in that coconut oil and take 1 or 2 eggs and maybe cook with it or put on top. The eggs, the phospholipids in the egg yolk make all of these carotenoids absorb better, but also there's a lot of lutein and zeaxanthin in the egg yolks, and also choline, which is great for the brain. And then you're going to have blueberries as a dessert and maybe sprinkle some pistachios in the whole thing. Pistachios are probably one of the best nuts to consume because it's also high in the carotenoids that are very good for your retina. And also, Dr. Summerton had brought this to my attention not too long ago, but eating eggs also can decrease the chance of dementia, not to mention macular degeneration. 4 eggs a week decreases a 49% chance decrease in late stage macular degeneration, 4 eggs a week, and a 62% reduction in the risk of wet macular degeneration. So if you have dry macular degeneration, it can turn into wet, but consuming at least 4 eggs a week is a 62% decreased risk turning into wet macular degeneration. Those are pretty powerful numbers, Dr. Summerton.
They are, and it also involves just kind of our point here is just taking care of your health helps take care of your eyes as well. And that's kind of the point we wanted to make today about May, the month of May being Healthy Eyes Month. And that's a number one priority is take care of your health. Eat those healthy foods. We want you to stay active. Being physically active, we know helps keep you healthy and keep your eyes healthy. Quit smoking. We don't bring this up very often, mostly because we hope that everybody knows that smoking is bad for you at this point. But it's not just bad on the eyes, and that includes smoking increases that risk of macular degeneration and cataracts. And then we want you protecting your eyes, the basics. If you're out there doing sports or construction work or home repairs, wear those safety glasses. On the computer, give your eyes a little rest, the little 20-20 rule. Every 20 minutes, you look at something about 20 feet away for about 20 seconds. That came from our friend, Dr. Jeff Anschel, who was a computer specialist there for the eyes. Wear that blue light protection to filter that excess blue light coming from the screen. And then if you wear contacts, just be smart about it. Always wash your hands. Make sure you don't overwear your contacts. Follow the instructions to make sure that your eyes get enough oxygen through the contacts and make sure we reduce the chance of infections. And all that just leads to a healthier vision and a healthier body at the same time.
Amen. And I just want to mention, we're getting ready to take a few more calls here. So hold on. There's a new study where they actually combined 9 studies, all right? And they analyzed 9 studies, and they found out if you consume omega-3 fish oil or eat more fish, basically if your EPA and DHA is higher in your blood, that's the omega-3s, you have a 30% reduction in risk of early macular degeneration. So all of you should be consuming omega-3 fish oil or eating more good quality fish. And all of you that listen that are on the carnivore diet, heck, you can do that, right? Absolutely. We all like a little bit of carbohydrates too, though. So remember, omega-3, we preach this on this show all the time. Remember to test your omega-3. Make sure it's not an ethyl ester molecule. Make sure it doesn't have ethanol attached to the backbone. And the way you do that is squeeze the contents of your fish oil in a styrofoam cup. If it rots a hole through that cup, I would personally think twice about consuming it. All right, we're going to go to Sam in Ocala. Sam, good morning. Thanks for holding.
Good morning. Let me just give you a quick history of my medical situation. I am 68 years old. In 1968, at the age of 11, almost 12, I was diagnosed with type 1 diabetes. And of course, in 1968, control of diabetes was a whole different ballgame than it is today, much more difficult. In 2005, I had diabetic retinopathy in my right eye. And I talked to you on the phone probably back around that time because I was going to an eye doctor, Dr. Mames, which you were affiliated or not affiliated with, but you knew him. He was on your show
Right.
from time to time.
Robert
And I
Mames.
talked to you about it. Yeah, he was a great doctor. I think he saved my sight in the right eye, although it's not great. But I still have sight in my right eye.
Right.
Then in 2006, I had a double transplant, pancreas and kidney transplant. So my diabetes was cured after I'm no longer diabetic since I had the pancreas transplant.
Hallelujah.
Yes. But now, I mean, all those years of being diabetic, type 1 diabetic, and again, back in the 60s and all, when there was no A1C, there was no AccuCheck, there was none of that back then. It's done damage to my eyes. I've been diagnosed with glaucoma and a macular pucker, in addition to the diabetic retinopathy. My right eye is not great. Even with glasses, I can't correct it like to 20/20. Although I did have cataract surgery in both eyes recently, and the vision improved in my right eye more than I thought it was going to. What can I do at this point? I mean, I've got glaucoma. The retina pucker is very frustrating.
Right.
I don't really have, it doesn't seem to bother me too much when I use both eyes, except when I read, like if I try to read a book, because as I'm sure you know, I mean, with the pucker, if I close my left eye and just use my right eye, there's not a straight line. The line dips down. And I guess when I'm reading, it starts to dip down too, because I have a hard time reading a straight line. I mean, my eyesight drops down to the next line when I'm trying to read one line.
Let me ask you this. How's your vision in the left eye?
Not great.
All right, but is it better in the left eye? Better in the left eye than the right eye?
It's better in the left eye. I'm I think I'm just a little bit better than 20/40 in my left eye. It's my understanding that you have to have 20/40 or better to drive.
Right.
And I still have my driver's license.
Well, good. So that's your saving grace. So I'm going to talk quickly because we got to still take one more call here. So I would recommend seeing somebody, an eye doctor that's in tune with nutrition. Of course, we're a little bit biased, Dr. Summerton or myself. I think Dr. Robert Mames in the Retina Center is one of the top retina specialists in the country. I mean, it's keeping him and seeing him per his instructions is going to take care of your retina. We can certainly take care of your glaucoma. But seeing somebody, since you have diabetes, since you only have one good eye and it's not that good, I think you need to find somebody that's also in tune with some holistic approaches as well, so we can help you possibly from a natural approach. Obviously, surgery and medication are very important, but there's a lot of things that can be done with diet and certain supplements, lifestyle adjustments, and that's an area that Dr. Summit and I are both experts in and would be happy to see in the Villages. That's just a hop, skip, and a jump from Ocala. Find somebody that's in tune with nutrition that's also an eye doctor in that area. But I think that's the next leap for you. And we've got all the technology to monitor you and follow your glaucoma at the Lang Eye Institute. And like I said, you already have a great retina specialist. And then from there, we can determine what you need.
Yeah, I haven't been able to see Dr. Mames because I've changed insurance and he doesn't take my insurance.
All right. Well, then I can see you and then I can find out who the best retina specialist is on your insurance. So at least you can use us as a way to get a referral into somebody that we think highly of. Okay.
Okay. And what number would I call?
All right. It's 352-753-4014. So 352-753-4014. And Sam, I hope that helps you out. We look forward to seeing you. And I got a jet here.
I understand. Thanks. Appreciate it.
You take good care.
Bye.
All right. We're going to Judy in the Villages. Judy, good morning. Welcome to Ask the Doctor.
Oh, good morning, doctor. Thank you for taking my call. I just have a very quick question. Good morning, Dr. Summerton.
Good morning, Judy.
I was just wondering if you could explain to me about focus and brain.
Yes. So Focus and Brain is our traditional fortified focus that had lutein, zeaxanthin, and astaxanthin. And we added a patented trademark form of citicoline called cognizine to it. And what happens as we mature, the citicoline drops in our body, and we don't get a lot of citicoline unless we're eating organ meats, which most of us do not eat unless we're on a carnivore diet. And so this is very good at giving the nutrition that your brain thirsts for, okay? It helps with memory. It
Okay.
helps with working memory. It helps with clarity. I swear it reversed my mom's dementia at 97. She's been on it 4 years now. But we have a
Okay.
lot of patients, Dr. Summerton, that are taking Focus and Brain that really have some positive information for us when they come in, don't they?
They do.
Well, I was in.
Such a simple.
Go ahead.
Go ahead, Judy.
Well, all I was going to say is that I've been seeing it, and some of my friends have been taking it. And when I saw your program, I thought, well, you know what? I think I'll ask all about it because I kill degeneration, and it will help, won't it?
Well, Fortified Focus has the lutein, the carotenoids that can help with nutrification of the macula. Yes. And so it crosses the blood-retinal barrier and the blood-brain barrier. So, like I like to say, it gives the nutrition that your brain and your retina is thirsting for. And Judy, we're about out of time, so I'm going to have to let you go, okay?
Okay, I'll pick up. Where can I get it?
Thank you, Judy. And Dr. Summerton, we got 38 seconds. Well, we got plenty of time to say goodbye today. So, to everybody, goodbye.